Question: which of the following conditions is characterized by a lawnmower or startup pain in the shoulder that worsens with overhead activities? A. Rotator cuff tear. B. Frozen shoulder. C. Tennis elbow. D. Carpal tunnel syndrome. Answer: A. Rotator cuff tear. Explanation: rotator cuff tears often present with pain in the shoulder that is exacerbated by lifting the arm, particularly overhead activities like using a lawnmower. This pain is often described as a lawnmower or startup pain. Question: which of the following fractures is considered a surgical emergency due to the risk of compartment syndrome? A. Cole's fracture. B. Femoral neck fracture. C. Boxer's fracture. D. Greenstick fracture. Answer: B. Femoral neck fracture. Explanation: a femoral neck fracture is a surgical emergency because it can lead to impaired blood supply to the femoral head, increasing the risk of avascular necrosis and compartment syndrome. Question: a 30-year-old male presents with localized pain, tenderness, and swelling over the medial aspect of his elbow. He reports repetitive throwing motions in baseball. Which condition is most likely? A. Golfer's elbow. B. Tennis elbow. C. Cubital tunnel syndrome. D. De Quervain's tenosynovitis. Answer: A. Golfer's elbow. Explanation: golfer's elbow, also known as medial epicondylitis, presents with pain and tenderness on the medial aspect of the elbow, often due to repetitive wrist flexion and pronation movements, such as in golf swings. Question: which of the following imaging modalities is best suited for evaluating ligamentous injuries in the knee? A. X-ray. B. MRI. C. CT scan. D. Ultrasound. Answer: B. MRI. Explanation: MRI, magnetic resonance imaging, is the imaging modality of choice for evaluating ligamentous injuries in the knee, as it provides detailed soft tissue visualization. Question: which of the following conditions is characterized by subchondral sclerosis and osteophyte formation at joint margins? A. Osteoarthritis. B. Rheumatoid arthritis. C. Systemic lupus erythematosus, SLE. D. Psoriatic arthritis. Answer: A. Osteoarthritis. Explanation: subchondral sclerosis and osteophyte formation are classic radiographic findings seen in osteoarthritis. Question: a 50-year-old patient with osteoarthritis of the knee presents with persistent pain despite conservative measures. What is the next step in management? A. Initiate physical therapy. B. Prescribe a topical NSAID. C. Consider intra-articular corticosteroid injection. D. Recommend total knee replacement. Answer: C. Consider intra-articular corticosteroid injection. Explanation: in patients with persistent knee pain due to osteoarthritis, if conservative measures have failed, intra-articular corticosteroid injections can provide effective short-term pain relief and are a reasonable next step before considering surgical options. Question: a 35-year-old athlete presents with acute Achilles tendinitis. What is the initial management strategy? A. Immobilization with a cast. B. Immediate surgical repair. C. Rest, ice, compression, and elevation. Rice. D. Immediate eccentric strengthening exercises. Answer: C. Rest, ice, compression, and elevation. Rice. Explanation: the initial management of Achilles tendinitis typically involves rest, ice, compression, and elevation. Rice. To reduce inflammation and pain. Question: a patient with suspected carpal tunnel syndrome has failed conservative measures. What is the next step in management? A. Refer for physical therapy. B. Recommend wrist splints at night. C. Order electromyography, EMG, and nerve conduction studies. D. Perform carpal tunnel release surgery. Answer: C. Order electromyography, EMG, and nerve conduction studies. Explanation: When conservative measures fail to relieve carpal tunnel syndrome symptoms, performing EMG and nerve conduction studies can help confirm the diagnosis and assess the severity, guiding further management decisions. Question: which medication is the first-line treatment for an acute gout flare? A. Allopurinol. B. Colchicine. C. Indomethacin. D. Methotrexate. Answer: B. Colchicine. Explanation: colchicine is the first-line treatment for acute gout flares, as it helps reduce inflammation and pain. Question: a patient presents with a suspected rotator cuff tear and severe pain. What is the initial treatment of choice? A. Surgical repair. B. Physical therapy. C. NSAIDs and rest. D. Intra-articular corticosteroid injection. Answer: C. NSAIDs and rest. Explanation: in cases of suspected rotator cuff tear with severe pain, initial management typically involves NSAIDs and rest to reduce inflammation and pain. Surgical repair may be considered later if conservative measures fail.